We come today to the last lecture on Carl Jung, and obviously, in such a short time, we can only have an introductory exploration of Jung. We started off with Jung's personal history, his background, his dealings with Freud, his separation from Freud, his own inner turmoil, the years of Nakia, and then we went into Jung's model of the mind. After doing Jung's model of the mind, which was a structural part of Jungian theory, we went into Jungian concepts. Then we tried to connect the structural concepts and the functional concepts to DSM pathology. So today we will do one more functional concept, connect it to DSM pathology, and lastly, take a look at how Jungian therapy is done. What are the steps involved in Jungian therapy? So let us start with one remaining functional concept, the concept of typology. What the word typology means is, it is an exercise to divide a given group of people into small groups based upon some criteria which we call as types. So any given universe can be divided into groups based upon some criteria, and this exercise is what we call as typology, where we divide a universe into groups based upon some criteria, and obviously every typology will have certain strengths and certain universal weaknesses. Universal strengths are, it allows us to look at the commonness in the group, and from there try to get some more insights about any given person, because people from his group share a lot of things with him. It also allows us to look into which group of people are predisposed to what kind of behavior and what kind of DSM pathology. On the weaker side, on the weakness side, any typology will have two problems. The first problem being, you are dividing infinitely unique human beings into a finite number of groups. And therefore, there will be people who either belong to two groups in different contexts, or who do not belong to any group but they are forced into some, or they are on the margins and you can see them moving to the other group if some values are changed. So these are universal deficiencies of any typology, that the ideal is to have a typology of one, but that defeats the very purpose, because then there is no typology. So the moment we divide infinitely heterogeneous population based upon some commonality into a limited number of groups, there always will be the boundary problem, the margin problem, and not fitting anywhere problem, or fitting at two places problem. So that is true for all typologies. It is also true for Jungian typology. But we will keep those statistical nuances aside and just look at the core idea of this concept. So Jung found it very useful to divide the human population into groups, and that gave him idea about how different people function differently. So in a way, the first purpose of Jung's typology is to account for differences in behavior, because it follows Jung's basic belief in design in nature, that there is a design in nature. Things are not random. Things are not just outcomes of exercise of human craving. And this design in nature leads to this typology, which is also designed by nature. It is not that human beings have come together and collectively deliberated and come to conclusion that we should have these types of people. It is naturally occurring typology. Second, it allows Jung, it helps Jung and helps everyone to better do therapy of a person by knowing what type he belongs to. Because that gives us an idea what are his predispositions and what likely things are going to be effective with him. And the third part is a typology will give us predispositions, and therefore it can also be used in a predictive way. Okay, certain types are more likely to be predisposed to disorder X, and therefore let us make the person aware and work with him so as to strengthen his resilience. So one use of typology is to know how people behave and what can account for their behavior. Second use of typology is in doing therapy. That certain types will respond good knowledge. Certain
Good.
types, I think Bhavna has joined.
Yeah. Good afternoon.
Good
So
noon, one and all.
good noon. So the uses of typology are this. It allows us to divide human population into groups and explain some of the human behavior based upon what group they belong. Second, it helps us to do therapy by knowing which group of people respond better to what kind of intervention. And three, it helps us to do a predictive resilience building by knowing predisposition of each group and trying to build the fortress before the flood comes. So these are the uses of typology. Now let us see how Jung goes into typology. The first criteria that Jung deploys on human population is what he calls attitudes, or I would use the word orientation. But Jung uses the word attitude, and he divides the entire human population into two groups, introverted and extroverted. The group whose orientation is more introversion and the group whose orientation is extroversion. The introverted group is more interested in the inner world of thoughts, feelings, and everything else. And the extroverted group is interested more in the outer world of people, society, movements in the world. Jung uses the notation I for introversion and E for extroversion. So the moment you apply this, you divide the human population into two groups. Obviously, somebody can say there can be somebody who is midway, who is an ambivert. Of course, they can be. But Jung goes into an oversimplified version here and recognizes that there will be people who will be between, and there will be people in whom the degree of introversion and extroversion may undergo a change over time. But as a simple measure, the first exercise in typology, Jungian typology, is to use attitudes. Is somebody interested more in the outer world or inner world? And those who are interested more in the inner world, Jung uses a word for it. They indulge in what Jung calls reification. reification, reification, meaning they start giving respect, treatment to the inner world entities like thoughts, feelings, and imagination as though they were people, as though they were concrete things. So this is something Jung calls reification. So the first exercise is introversion and extroversion. Then Jung uses 4 functional orientation to divide each of them further. And the functional orientation means how do you use your faculties. The first one talks about which area of reality interests you more, inner world or outer world. And the second talks about how do you use your faculties in responding to events. So this is almost like the schema of responding to events, an epistemological schema of responding to events. And Jung uses 4 elements there: sensation, thinking, feeling, and intuition. So there will be one group of people who are very driven by the sensations, the physical aspect of things. And I will give an example to make it easy. But there is one group which is more interested in the physical aspect of things. There is a second group which is more interested in thinking about things. There is a third group which is more interested in arriving at judgments about things. And fourth group which is interested more in intuition and in thinking on a larger domain, a much deeper domain, completely away from the situation where they are in very essential generic terms. Now let me give an example. This is an example from the book by Anthony Stevens. He gives the example of there is a fight outside a pub. There is a fight outside the pub, and in that fight, one person beats another and he falls down. Now 4 people look at that event and each of them describes the event differently. So if you ask the sensation type, what happened? He will describe the event like this. He will say, there were 2 people standing outside the pub. One was 6'4" in height and 85 kg in weight. Second was 4'2" and 75. The big person slapped the smaller person and he fell down. This is the description of the sensation type, a very physical description. Almost like a physics teacher. The thinking type will say, since they both of them were young and they came out of the pub in the evening, they must have had an argument over the football match last evening. Because people of this type, they actually like the football matches and they must have fought over it. So he is trying to think out. He is not interested in how tall, how thick, how strong, how weak. He is interested in the thought aspect of it. Why did they do what they did? The third person is the feeling type. He describes the event as this. He says, this place seems to be one where people of this sort come and go. This is not a place to come with your family if you want to go on an outing. This is not for good people coming from good families to come here. So he is evaluating the place, and therefore what Jung calls feeling, the better word would have been evaluation. But then the feeling would be nowhere inside. So what we have to do is, although Jung uses the word feeling and describes it in terms of evaluation, we will do evaluation plus feeling as feeling. Otherwise, affect will be nowhere in the 4. So when Jung says feeling, actually describes evaluation. That people who want to arrive at judgments, but then the affect is not there in all the 4. So we will say feeling is feeling and evaluation both. And the 4th is the intuitive type. He describes the event like this. He says, what else can happen when you have such an economic divide in the society? This class structure leaves people with no option but to drink away their misery by going to a pub and release their aggression, their frustration with life over each other. And unless we fix the educational system and unless we go into a democratic economic system, things like this will keep happening and we will see innocent people getting victimized. let us try to see what we can do to make this world a better place so this kind of events don't happen. So he is going completely into a different tangent, into generic philosophical thinking. So the event is the same, the stimulus is the same in the outer world, but the response is different because the stimulus is being processed by a mind which is of a particular type, and based upon the type the response is coming out. So the response is not automatic. There is a variable called the type of the mind. Every mind is not the same. There is a variable called the type of the mind. So this is how the four are. Now when you combine the two, what will happen? You will have introverted people which can be divided into these four types: introverted sensation, introverted thinking, introverted feeling, introverted intuition. Similarly, extroversion, same thing. And you will come at 8 different types of people. So the first category divides people into two, the second category into four. These are called functional orientation. So attitudes divide group people into two, and functional orientation divides further each of the attitudes into four, and therefore we are left with 8 personality type typology. Now, many times in colleges, professors of history make students do this exercise. They will say, okay, recently, about 2 years back, a particular event happened in a particular city. You go there and record the history of it. And each student comes out with a very different recording of history. And then the professor tells them how difficult it is to arrive at true history, because the subjectivity of the historian and the subjectivity of those who narrate the event, they often color the objective evidences of the event. Now, when we talk about the subjectivity of the writer, the subjectivity of the historian, or subjectivity of anyone working in the area of social sciences, the type of the person will come in. There is no way in Jungian framework somebody can be free from the type that he is. And therefore, all his responses will have a stamp of the type. And if we know what type we are, we can overcome some biases or limitations that our type brings to us. So from individuation point of view also, typology is important. If you are doing occupational counseling, trying to tell people which job will be best suited for them, then typology is very important. The Jungian typology is pervasively used directly or indirectly in occupational counseling when you are trying to tell somebody what kind of job he fits into. So we have one attitude, introversion or extroversion, and 4 functional orientations. Now Jung further divides these 4 functional orientations into, or rather gives certain description and weightage to each of these 4. So what he says, every person, according to Jung, has one version, either introversion or extroversion. And every person has 4 functions. So one attitude and 4 functions, but these functions are such that one of these 4 is dominant. One of these 4 functions is dominant. And we'll see what happens if each of them is dominant. Or we can see it right now. If sensation is dominant, what DSM pathology can it lead to?
Phenomenological.
Yeah, but in DSM terms,
India symptoms.
Histrionicity.
Histrionicity. Yeah.
If thinking is dominant, then
Delusional or obsessive.
correct. If feeling is dominant,
BPD and bipolar.
correct. If intuition is dominant, psychosis, the man will be lost in the inner world, completely detached from the outer world. So, what Jung says is that all of us have four functions, but one of them is dominant. And in order to balance the dominant, another function which is completely unlike that function, almost an opposite of it, that becomes auxiliary. So, for example, if somebody is sensation type, sensation is dominant, then for that person, intuition will be the auxiliary. And for some person, thinking is dominant. For that person, feeling will become auxiliary. So there is a dominant function, then there is a balancing function which is called auxiliary. And there is an inferior function, the least intense of all the four, the weakest of all the four, that Jung calls as the inferior function. The number 3, he does not go into very much. So for Jung's theorization further, what is important is one version out of 4 functions, one is dominant. There is another which balances the dominant called auxiliary, and there is the weakest function called inferior function. Now let us go further to see what does it mean. So if sensation is dominant, then feeling, this intuition, is auxiliary. If thinking is dominant, feeling is auxiliary. If feeling is dominant, this is auxiliary. If this is dominant, this is auxiliary. That is the way they balance each other. And when you put together with introversion or extroversion, you will see like this. A person who is introverted and has intuition as the dominant function, his balancing auxiliary function will be extroverted sensation. If somebody has extroverted intuition as dominant function, his auxiliary function will be introverted sensation. If somebody has introversion as attitude and thinking as a dominant function, then what will balance it? What will balance it is extroversion and feeling. This will be the auxiliary function. So left hand side are the dominant functions, right hand side are the auxiliary functions, and they balance each other. If somebody is introverted with feeling as a dominant function, his auxiliary function will be extroverted thinking. Then the thinking will be directed outside, not inside. Because thinking can happen both ways. Like if you look at extroverted thinking, you are looking at an engineer. If you look at introverted thinking, you are looking at a psychologist. So this is how we end up with these 8 types in the Jungian typology. 4 extroverted types and 4 introverted types. And what is written here are the dominant functions. Extroverted thinking means the person is extroverted and thinking is a dominant function. What will be the auxiliary function for this? Introverted feeling. For number 1, auxiliary will be introverted feeling. For number 2, auxiliary will be introverted thinking. For number 3, auxiliary will be introverted intuition. For number 4, auxiliary will be introverted sensation.
Sir, what would be extroversion intuition? What does that mean? How it is different from Introverted intuition. Can you just explain that?
Extroverted intuition is very strong in fashion designers.
Okay.
They want to know what people will like in the next season. They have to intuit it out. You can't data extrapolate.
Basically, the expressive form of the intuition.
Correct. Intuition applied to the outer world.
Fair enough.
And if you talk of intuition applied in spirituality, in psychology, all of these are introverted forms of intuition.
Okay.
Where would you put Jung into this?
Introverted.
To give doctor his medicine,
Introverted intuition.
his introverted intuition.
Right.
Now, typology and pathology, how do you relate that to? Jung believed that typology helps us to understand personality differences, helps us to understand communication styles, helps us to understand what the person understands from an objective stimulus. Because he will understand based upon his type. Emotional conflicts that different types experience differently, and sources of misunderstanding between people. Now, what happens when something is overdeveloped or underdeveloped? If one function is overdeveloped, it can lead to personality disorder or eruption of unconscious in some way. If one function is overdeveloped, it can lead to rigidity or it can lead to oddness. And the inferior function is the most repressed one. It can lead to unconscious eruption or balancing the personality, which can come out as a symptom. Now let us look at this chart and connect each of them to DSM disorders. Too much of introversion, what does it predispose the person to? In DSM terms, social anxiety disorder, avoidant personality disorder, schizoid personality disorder. Too much of extraversion, ADHD traits, manic traits. In fact, it's exhibitionism in all its forms. Too much of thinking, OCD and schizoid traits. Too much of feeling, borderline, bipolar, dependent or histrionic traits. Too much of sensation, histrionicity, impulse control, substance use. Too much of intuition, schizotypal personality traits, psychotic spectrum. Too much suppression of the inferior function, anxiety, addiction, or bipolar. So this is how each of them is connected. That when something within the typology concept basket, when something becomes too much or too little, it predisposes one to this DSM disorder. That is how the concept is connected to DSM disorders.
Sir, I have a question here. Like the typology and the pathology you're explaining, this most of the things seems to be more of life force driven thing. What about death instinct driven things like narcissism or conduct disorder or ODD? How this would play out there?
It is not easy to explain those things within this table.
Framework, okay.
In this table, if we bring in the archetypal concept, then we can explain that. For example, let us say if you talk of MDD, then in MDD, the feeling will be overdeveloped, introversion will be overdeveloped, but it's not necessary always. So what we will need is, let us say if we talk about sadness driven MDD, then yes, within the table we can explain. Talking about a feeling overdeveloped thing. But talk about guilt induced MDD, then it's very difficult within this table to do something. Then we will have to bring in the archetypal concepts of morality or some archetype, which is the moral archetype punishing oneself.
Okay.
So some disorders we can explain within this table. Other disorders we'll have to bring in other functional and structural concepts of archetypes or of individuation or of ego self axis, and then we will be able to explain.
Right, sir.
Now, how typology is connected to individuation, because for Jung, individuation is the most important. Healing the symptom is secondary. In fact, Jung looks at a patient more like Bhavna looks at the patient. Because Bhavna,
Is it, sir?
yeah, Bhavna looks at the patient more as she uses the word, she does not use the word patient. She calls the person seeker.
Right, sir.
And Jung looks at the patient more like a seeker. That the seeker is seeking individuation and self-realization, and healing of the symptom is something happening on the way. So in Jung's view, for balanced development, inferior function has to be recognized and developed. We have to consciously work upon our inferior function for balanced development of our personality. Second, we have to balance introversion and extroversion. That does not mean 50-50. It's not a mathematical balance. It's an individual subjective balance. For some person, 30-70 may be the right balance. For some person, 40-60 may be the right balance. So it's a subjective balancing. It's not a mathematical 50-50. Integrating unconscious aspects of the personality based upon what we find from application of typology. That the idea of typology leads us to what aspects of personality are more unconscious or less developed. And typology can be used both for healing as well as for predictive purposes. That a sensation type is more predisposed to histrionicity, an intuitive type is more predisposed to psychosis. So if we get a patient of a particular type and we see some slide in that direction, we can start working before the symptoms make an appearance. It's a predictive part of typology. So based upon it, this Jung's theory of typology, we have very popular MBTI personality types. And we won't go into the 16 MBTI types, but just to say it's basically based upon Jung's typology with some modifications. Like they bring in two variables, P and J, which are not there in the Jungian typology. So P refers to perception instead of sensation, and P refers to
J
refers to judging rather than the evaluation part. So they make some modification, but essentially it is based upon the Jungian typology. Now, what are the psychological tools and tests within the Jungian framework that you can use for different purposes? You can use Dalton's word association test to explore the complexes, MBTI for occupational counseling, MMTIC for a child version of MBTI, SLTDI to measure Jungian psychological functions, how strong or weak they are. Similarly, Jungian personality preferences and alternative measure of Jungian personality type. So in the Jungian frame, these are the tests that you can use. Some more tests are here.
Dr. Vaidya, are they validated on the Indian population?
Most of them, I don't think.
Okay.
I have not gone into that part, but I don't think most of them are validated. If you want to go specifically into archetypes, then you have this PMAI and this King, Warrior, Magician, Lover inventory. It's a very interesting name. King, Warrior, Magician, Lover inventory. And then you have the classical projection techniques like sentence completion, projective drawing, sand play, and so on. And you can use any of the projective tests and make a Jungian interpretation of it. So even if somebody is using Rorschach, you can have a very specific Jungian interpretation of Rorschach. In fact, there is a very good book on this, Jungian approach to Rorschach, something of that sort, where all the responses somebody gives on the Rorschach test in the Jungian framework can be interpreted in a unique way. And that is true of any school. Every school will interpret the same responses to Rorschach in a different way. Okay, now we come to the core of today's discussion. How do you do Jungian therapy? What are the steps? There are many ways to really divide Jungian therapy into steps. I have put on the slides two different models, but one is this, the very simple one. The first step is assessment and relationship building. Second is identifying the conscious attitude. Third is exploring the unconscious, largely the personal unconscious, partly the collective unconscious. Fourth is working with the shadow, what we call shadow work. Step 5 is working with the complexes. Step 6 is integration. Actually, it is both balance and integration. 7th is developing the inferior function. And 8th is individuation. So let us go into it one by one. Do you find this logical?
I haven't really studied Jung in that depth, so I won't be able to say.
If you take up therapy of any school, it will have some generic things.
Hmm.
You will always start with case history and assessment. Step 2 always will be trust building and safety. Step 3 will be moving into the conscious. Step 4 will be moving into the unconscious. Step 5 will be dream work. Step 6 will be very deep exploration. Step 7 generally should be catharsis or integration. And step 8 will be moving closer to the goal of therapy, whatever be the goal. Now the goals are different. Each school has its own goals in therapy. Like if you talk of classical psychoanalytic mainstream line, Freud, Klein, Bion, the goals are very simple. Heal the symptoms and discuss with the patient if he feels he has known himself enough. And that can be the termination of therapy. If you get into Lacanian school, then the idea is to know the symptom so profoundly that the symptom gets separated from the suffering. It is like exhaustive articulation of desire in a profound way. So the cure of every symptom is not the goal.
Cure of every symptom is not
the goal in the Lacanian framework. Like he describes a term called syntheon. It is like a near term to symptom, syntheon. So what it means is you start with a symptom, do the therapy. Let us say 75% of the symptom is cured, 25% remains. Therapy is not moving forward. You are stuck at 75%. But the person understands it so deeply and now knows how to create an idea of good life, accepting that this 25% is going to be with him. So that what remains, the last 25%, which the person has profoundly understood and accepted, and around it, including it, made an idea of a good life. That is called syntheon. So on my channel, there is a discussion titled Syntheon Not a Cure.
Yeah.
So that goal is a very different goal, that you have to articulate the desire completely. And if you are cured, well and good. If you are not cured, then maybe you leave the therapy with a syntheon.
Learn to live with it.
Yes.
Rather find a meaning in it
Mhm.
and have an acceptance towards that.
Mhm.
I think, sir, isn't it something very similar to your model in which we talk about the story of the pathogenesis, how each school would be looking at it makes a difference here.
Correct. Correct. Many Lacanians give this example, which is of a man who had this obsessive exhibitionist disorder, that he would go to a pub every day, drink, come out, and after coming out, he would walk a few paces and then he would urinate in front of everyone on the wall. So people complained and he was put in therapy. And after coming out of therapy, again did the same thing. And he was asked, okay, what has therapy then done for you? You're still doing the same thing. So he says, I no longer suffer. I know what I am doing and I am comfortable with it. And I'm also comfortable with what people talk about. So the symptom is there, but the suffering is gone. So that is a kind of syntheon that they talk about. So often, this is the way normal therapy will go. And if you look at this framework, it is not very different. That you are starting with case history and relationship building. Then you are moving slowly from the top downwards. You are first going to the conscious part of the personality, then unconscious part with the dream work, then deeper, more difficult part of yourself, shadow, archetypal component, balance, integration, developing the inferior function, and then moving towards individuation. What is interesting is at no step we have a stage which says completing the removal of symptoms. That point is not there. So how does Jungian therapy go in each of the steps? The first one is assessment and relationship building. This is typically done by case history and by Jungians don't use that word, but it's holding, allowing the person to speak out all that he has to speak out. He should be free to speak, not only free, he should feel safe to speak what he has to speak, feel what he has to feel, so that he is able to heal himself. So after case history, safety is primary and holding is primary. That allows for trust building. The therapeutic alliance, the capital of it is built. Second is to look into the life of the person and allow him to speak about his conscious life. What is his personality like? What are his values? What typology does he belong to? So the second is identifying the conscious attitude and the conscious life of the person.
Dr.
All
Vaidya,
that he can describe. Yeah, Shalini.
Questions. Roughly how much time, if we go by the time criteria, how much time is typically given for this first stage? And the second question is, how do we assess the values?
It can be done in two ways. If one is very particular about values, then one can use instruments. But if one is looking only at a broad direction of belief, then one can just look at it in terms of some continuums, like somebody who is open or who is closed, somebody who is conservative or who is modern, somebody who believes in, who is strongly ethical or who is more flexible, somebody who is more driven by money or more driven by ideals, somebody who values inner things of life versus somebody who values outer things of life, somebody who believes in means to goal or somebody who believes only in the goal. Means don't matter. So these are the typical type of things that we go into, generally in terms of values. But if somebody is very particular or if a need arises, then one can look at instruments to find out what exactly is his orientation and intensity on a given value. So there are many instruments to actually explore value. Now coming to your first question, how much time does it take? It depends. Two primary factors, but one generic thing, I would say the first 10 sessions by and large can be used for this particular first part, and the next 10, next 5, sorry, in step number 2. So if you put together that they are not so neatly bifurcated but they overlap in practice, then 1 and 2 put together I would put at 15 sessions.
Okay, thank you.
So it is not completely a neat chronological bifurcation like this, that you complete step 1 and then come to step 2. Step 1, of course, you can put as step 1, but 2 often overlaps with 1. 3 and 4, there can be a lot of overlap. So there will be a crisscrossing of stages, but to just make it a simple enlisting, I have put it this way. So
So
the
in
first,
quick therapy sessions, one can design their own questionnaire where they can have a deeper reflective understanding of these to reduce the number of sessions and to start off with something more specific, and later on we can keep on exploring. Like I think 3 to 4 sessions, if we have a handy questionnaire subjective to the patient and the client, whatever they're looking for, that can be a great tool to reduce the load of the sessions uh, till we have a deeper. Is it fair enough to do so? Because sometimes I do that.
so it depends on two things. One is the patient and second is our approach. I'll give two instances. For example, if we divide the patient into mild, moderate, and severe, and if in moderate or severe we are dealing with fragility, then we will require a long time. But if we are not dealing with fragility, then we can quickly compress this part. One part. Second, as you rightly said, if we use instruments, then we can reduce it even further. The difficulty there is, okay, we may know a lot about the person, but the person does not know that we know. Now it makes a difference. For example, let us say I am very good in doing Sherlock Holmes work when I get a case history.
Hmm.
So the moment I have a case history and I have talked to the person for 2.5 hours to take the case history, I do pathogenesis and I have a fair idea about what happened in his childhood.
Hmm.
The person does not know that I know. So he does not have that kind of comfort which he will have after 10 sessions when he knows that I know everything and I'm okay with it. So there is one aspect that when you invest that time, it is not only for us but also for him, and he will need time more than we do. Because if our skill is high, then just with the case history, we can do a lot of things. We'll know about him far more than he has told us. But he's telling us and our accepting it without any moral judgment, that is more important to him than our just knowing him. So this is second part of it. Now, you have raised a question about, which also leads to the school orientation. For example, in ISTDP, there are some practitioners who are on the extreme, and they start ISTDP process without taking case history. And their idea is that when the person has come to you, everything is boiling inside, that is the best time to undertake catharsis. And case history can wait. It's not running away anywhere. Even if you take it after 2 weeks, it will still be the same case history. Don't worry about it. Case history is not a perishable item. So you are going to get the same case history after 2 weeks, but now that everything is boiling inside, it is the right time to intervene. And the danger there is that you don't know much about the patient. And the way they overcome this is by knowing the anxiety patterns of the patient. That is the anxiety going into striated muscle? Is it going into smooth muscle? Or is it going into the cognitive perceptual disturbance? That will tell you whether the patient has good ego strength, moderate ego strength, or is fragile. So there is an extreme of it which says, don't take case history because you are dissipating the build-up which is so necessary for catharsis. So that is one extreme. The second extreme is, and I should, interestingly, within ISTDP itself, there is a second extreme, which says, like, I would believe John Fred Erickson would go for direct engagement with catharsis without taking case history. And another person in ISTDP, let us say Dr. Allen, he would take the case history, he would do the psychological testing, he would think about it, and only then take the first session. So within ISTDP itself, there would be two schools. And I'm not sure in the Jungian context if there are adventurous people who directly go to catharsis or directly go to the shadow work. But
The clients who come up with dream analysis exclusively, that is where sometimes it is direct, later on followed by case history.
yeah.
And I'm also thinking if somebody comes with florid symptoms of psychosis, then maybe directly tapping into the archetypal work might be better.
Yeah, right. That's a very interesting situation because the client is not in a condition to give a systematic case history.
Yeah.
So the first is assessment and relationship building. And the tools used are case history and safety-oriented, holding-oriented therapy. Identifying the conscious attitude. So we are going step by step. So we go into personality, values, typology. Exploring the unconscious, that is where the Jungian dream work becomes so important. And we explore both the personal and the collective unconscious. Then we get into the shadow work, which is where the real difficult work begins. Encounter with one's shadow. Then we go deep into the archetypal work. Then into balance, because now we have a fair idea where in the personality lack of balance is. And then we go into integration, which is even more difficult work. This 5, 6, 7 will come only if the person is in long-term therapy. Then we have to work upon the inferior function using typology concepts. And last is set out the person on the path of individuation. And as he goes on the road, difficulties will come. How do we remove those difficulties?
Dr. Vaidya, can you speak a little bit more about the shadow work, and also how is transference and countertransference looked at in Jungian framework?
So in shadow work, we confront the parts of us that we don't want to look at. So how do we find? We find it out partly by analyzing the life events the person is narrating to us. So the person will be mean, will be destructive, will be envious, and repress it inside of himself. There will be very few people who will come and say, this is what happened today, and today I was mean to him, I was envious to him. That work is left to us. So when somebody is expressing his everyday life, and we see that there is a repressed part of it, unaccepted part of it, split off part of it, we bring that into analysis. That is one. Second is the interpretation of dream. That is very important for shadow work. And the third is the shadow below the symptom. That whatever symptoms he has come up with, what is the shadow part of the personality that would be related, or that would be even the base of that symptom. So that is where that part comes in. This has two components: the analytical component of acceptance, analysis, and recognition. And second is the catharsis component of releasing difficult feelings. But Jung, in that sense, is not a very hydraulic person. Like if you look into all the 8, Jung is not catharsis heavy. Unlike Freud, unlike IHTDP, Jung is not catharsis heavy. So shadow work includes all of it: analysis of everyday events, analysis of dreams, and analysis of the story of the symptoms, and analysis of what happens between the patient and the therapist. Because whatever problems are there in real life, in some way, these problems will also come up in the therapy. So all of this goes into shadow work. Now coming to transferences. Every school will interpret transference in terms of its own concepts. So the moment you have archetypal concepts, you will say there is a transference of the predator archetype. There is a transference of the magician archetype. There is a transference of the self onto the therapist. So based upon your concepts, you will use transference. Like if in the Freudian context, you cannot have a shadow transference or archetypal transference because there is no concept in the theory. In the Jungian framework, you cannot have a part-object transference or a self-object transference because it's not a part of the theory. If you go to Klein, you will have part-object transference. If you go to Kohut, you will have a self-object transference. If you go to Winnicott, you will have the transitional object transference. but those things will not be here. So here what you will have? You will have archetypal transparencies and the traditional transparencies of the mother, the father, and so on.
Also that of shadow, projection of the shadow.
Yes. Yes. So when you talk of the positive transference and the negative transference, by and large, most archetypal transparencies will have this continuum of the positive and the negative, like the all good mother transference and the all negative mother transference, the all good magician transference and the evil magician transference, the naughty trickster and the evil trickster. So most transparencies, not all, sorry, most archetypes will have their extreme positive and extreme negative versions. Yeah, Shalini, any question?
I think I was just trying to understand how is the interpretation offered by the analyst, if at all it is given. I can imagine that Kleinians and perhaps even Freudians would be more proactive in offering the interpretation. I was wondering, do Jungians do that, especially when we are talking about archetypal? So basically, I'm getting a little confused between encountering the shadow and doing the shadow work and then working with complexes and archetypal work. Like, how are they different?
The shadow work can involve some archetypes at work. It may involve some complexes in the personal unconscious. So it includes all of it because shadow is more like an aggregating concept. It is not a standalone concept, it's an aggregating concept. So all that is unacceptable to us, all that is difficult in us, all gets clubbed together under this category called shadow. So it's more like a category concept rather than a unit concept, shadow.
Okay. Okay.
Now, the second part about it is, what did you ask?
How is the interpretation offered, especially when
Yes.
doing like archetypal work?
So, one of the things about transferences is, okay, what to do with the transference. That is as much of a problem in Jungian therapy as in any other therapy. So the core issue is, do we want to deactivate the transference, or do you want it to continue?
What are the implications, sir? If it continues, what happens?
Yeah. So if it continues, then what happens? And if it discontinues, then what happens? If it continues, then it depends upon what is the nature of the transference. Let us say we divide transferences into two, say positive and negative. If a positive transference continues, then the therapeutic alliance capital is built and the person feels better because he has somebody that he likes. And when the positive transference happens of any type, whether it's that of a positive mother, positive father, positive teacher, positive healer, any archetype, but a positive transference, what will the patient do? The patient will feel very good about you. He will become your ambassador. He will market you to others, saying that they should also come to you. He will ask for more sessions. He will say he doesn't realize when the session time just flows by. And I wish there was a 2-hour session. Some who are more expressive will also read out poetries to you. Some will start even dressing like you. They will start observing what products you are using and try to mimic you. So these are outcomes of positive transference. And in some cases, they will fall in love with you. These are all positive transferences. And the negative transferences are when they don't feel like coming to the session. They hate you They start seeing all the evil in you. How slow you have been, how much money are you charging, how you don't know certain things. You ought to know. So that is where the therapy breaks if it becomes too high. So negative transferences always have to be interpreted, because an absence to do that can easily lead to termination of therapy on part of the patient. So negative transferences always have to be deactivated as far as we can do it. Positive may we have two options. If we want the positive transference to go on, because one of the factors is some patients may need an omnipotent all good object because they never had one in their childhood and they want to internalize it, but for internalizing it, it has to be present before them. And if it is present before them for a reasonable amount of time, their unconscious mind can internalize it, identify with it, and make it their own. And this is very necessary for their healing. That the core of their healing is internalization of a good, reliable, stable object. So the good, reliable, stable object has to be present for adequate amount of time for the internalization to happen. Now, when we realize this, that the patient needs to internalize a good, reliable, stable object, and he has put positive transference upon me, so now I am the good, reliable, stable object, then in such case, it is better to allow the positive transference to go on and not prematurely interpret and deactivate it. Now the second part comes. Let us say the positive transference has been there for a long time and the patient seems to be healing very much, and you believe that much of what was necessary for internalization has happened. Now, if you don't deactivate, so if the internalization has happened, the objectives of having positive transference have been largely accomplished. Now we have to go into a movement towards reality. That at some point, the patient has to start seeing the therapist in somewhat realistic way. So then you have to deactivate the transference. Then the question comes, how much do you deactivate? Because if it's completely deactivated, the chances are the patient will leave therapy. So some degree of transference, if it is there, positive transference, it is good for them. It also gives power to our suggestion, power to what we say. Because what we say passes through the screen of omnipotence and gains that power. So negative transference, better to deactivate. Positive transference, better to keep till necessary, and then deactivate slowly and deactivate in a calibrated way, not necessarily go to zero. That one can do towards the end of the therapy. So this is how the continuation, activation, deactivation, and calibration of transference is essential. Now, there are two ways of doing these things, three ways. One is self-revelation. If the patient is thinking very highly of you as an omnipotent object and you do some self-revelation, the whole edifice collapses. Second is you bring it into analysis. Bring it into analysis, then in a calibrated way, you can deactivate certain transferences. Or you get into interpretation mode, where you give one interpretation which is so hard, it just shatters that projection. Now, in the Jungian approach, usually sharp interpretations are not used. So what is used is generally analysis and some dose of self-revelation. That is how two strong transparencies are managed. Any questions, Shalini?
No, thank you so much, Dr. Vedya.
One of the weaknesses of this is that Jung does not go so much into projective identification. And that concept you don't see much even in the Jungian discussions. And in difficult patients, there is more of projective identification. And that is something that usually we don't see Jungians discussing that. But
I think one of the concepts that Jungians do touch upon is participation mystique. So I think that comes closest to the Kleinian projective identification.
yes. The difference between the two is in participation mystique, both are completely absorbed in that phenomenon.
Yes, more like an unconscious to unconscious.
Yeah. Both are completely absorbed, but here the therapist is not absorbed, but is still receiving projective identifications. So it is not exactly the same, but as you said, it comes closest. And one of the reasons is that projective identification, neither Freud nor Jung were deep into it because it was largely explored in the Kleinian line. So Klein and Bion, they're among the heaviest in the use of the concept of projective identity. I have seen even in ISTDP, very few people are comfortable or conceptually comfortable or practice comfortable with projective identification. It requires some self-training to really look at projective identification. And even more training to look at delayed projective identification, where you get the projective identification identified inside of you after the session is over. Or at times, even without a session, you start to get to feel what the patient is feeling. And then when you back check in the session, it comes out to be true. Any questions on this? Another way of describing the same process is this. This is also Jungian therapy in stages, but the process described differently. Some people use this model. They say the first stage should be of self-revelation of the client, not of the therapist. The second is analysis and elucidation. Third is education, prescription, and how to live kind of analysis. Fourth is transformation, and fifth is individuation. Another way to classify the same process, but the first one is more crisp and detailed. Should we break for a cup of tea for 10 minutes?
Yes.
So shall we get case histories to read where Jungian analysis is seen and applied to different cases?
The Ahmedabad Jung group probably would have it.
Okay.
Let me talk to them if they can share.
Sure.
Because in the
Because
Jung group, there are about 5 to 7 people, I believe, who are training to be Jungian analysts. So they would have this material.
Thank you.
Okay. So 10 minutes.
Yes.
So how do you do it in everyday terms, operational terms? Before that, it's very interesting to see it. Often, even after the therapy ends, the transference doesn't end. Even though the therapy is over, the transference still continues. And that is true for practically any medium to long-term therapy. That's one of the reasons why those are very quintessential psychoanalytic therapists or Freudians and Kleinians or Bionians, especially Freudians and Kleinians. Even after the therapy is over, they will still maintain the frame. They will not do self-revelation. They will not meet outside the therapy room. The idea is that if in future, what if the client needs you again? Then this transparencies and the frame helps. Winnicott and Bion had a very different take on it. They were not so fond of keeping the frame as it is after the therapy is over. In fact, Bion went with one of his clients after the therapy was over. The last day, the last session, after the last session, they went on a dinner together, which was like a taboo, a kind of a sacrilege in psychoanalysis. Okay, Jungian technique. Contrary to Freud's on the couch, this is on the chair, face to face. Contrary to Freud's 5 days a week, usually it is 2 days a week, in some cases 3 days. In this technique, there is a lot of self-revelation done by the therapist, not as much as an existential psychotherapist would do, but far more than a classical psychoanalytic therapist would do. So the idea of the blank screen is not as valued in the Jungian framework as much it is in the Freudian Kleinian framework. Dream analysis takes in fact, I recollect what Jung said once. A patient came to Jung and he said, "So you are in a soup too." Meaning, I am in a soup and you are also in a soup. Now that kind of self-revelation, a Freudian or Kleinian will never do. They will preserve the blank screen. But compared to Freud, Klein and Bion, Jungians do more of self-revelation. As I said, less than an existential therapist would do, but more than the classical. Dream analysis takes far more time in the Jungian technique than in other techniques. I think the Jungian school is probably the one that gives most significance to dreams. So dream analysis finds highest significance in the Jungian technique. In fact, if you talk to many Jungians and you pose to them some involving problem, it's very likely that you will get an answer where they will say, "Let me sleep over it, let me dream over it and then come to you." So at a personal level, as well as for therapy, Jungians place the highest importance on dream analysis compared to other schools. It is focused on individuation and symptom removal is secondary. So the focus is different. So it is more of a self-growth school than a clinical school. A clinical school is largely focused on symptom removal, whereas a self-growth school is more on individuation. This school sees crisis as an opportunity. It doesn't see a DSM disorder as an unmitigated evil. It sees that more as an opportunity. This is a very different way of looking at pathology. So Jungians look at pathology as something that has a purpose, and this brings up this whole idea of the purpose of pathology. That is the pathology just another unfortunate event in our life, or is it a purposeful event that is painful on the surface? And the Jungians look at pathology as a purposeful event that is painful on the surface. They don't look at it as an unmitigated, unfortunate evil. So they focus on the purpose of pathology. On my channel, there is a discussion on this subject, the purpose of pathology. And one is reminded of what Jung said about one of his patients. He said, "Thank God he became neurotic." Meaning, if he had not developed the disorder, he would have never come to therapy, never looked inside of himself, and never walked on the path of individuation, and life would have just passed by. He would have missed the most precious chance in life, that is the possibility of individuation. So the most precious thing in life is to walk the path of individuation, and before that, one has to find one's path of individuation. And both of them require a deep inward journey. Unless you give time to yourself, unless you take interest in yourself, unless you do that deep inward journey, you can't find your path of individuation. You can't start walking on it, and you cannot remove hurdles on the path. And that is a missed opportunity. So in the Jungian context, the psychological crisis, what we call a disorder, is also seen as an opportunity. And the core of the Jungian technique is individuation. That the whole Jungian work is centered around individuation. And that has two parts, as I said. First, find out what you are that you have to become. And then walking on the path. And third, solving problems as they occur on the path. And then fourth, go on living on that path as much as you can. So this is a broad idea of the Jungian technique. Any questions on this? Now, how does healing happen in the Jungian approach? The first element that heals is the articulation of the symptoms, because the story of the symptoms is very important. In the first two steps of Jungian therapy, we allow the patient to do active imagination. Active imagination about the story of the symptoms. So when somebody articulates it, that articulation itself heals to a minor extent. Second element that heals is establishment of balance. The establishment of balance contributes partly to healing. Third element that heals is dream work. that the unsaid stories now come out in the open. The hidden stories now come out in the open. Fourth is the shadow work. Working on unacceptable parts of ourselves, the dark part of ourselves. Fifth is integration, which is a step beyond balance. Because in some cases it is balance and in some cases it's transcendence. Sixth element that heals is authenticity. When one starts looking inside and allowing the inside to come up and create a good balance of the inside and outside and not be carried away by outside and learn to live according to the inward command, that creates authenticity. And that also heals, because we all want to be authentic, but we are not able to. And the more authentic we are able to be, more we are living in our true self, to use Winnicott's words, and the more we feel healed. The more we feel rounded, the more we feel true to ourselves. The less of a liar we feel we are, less of an imposter we feel we are. It is dichotomous, but clear in a developmental sense. Yes, sir, you were saying something.
So how can the patient, how do we know how the patient decides whether the therapist is authentic or not?
No, no. This is all happening inside the patient.
Yeah. But then do we get an idea whether the patient is judging the therapist to be authentic or inauthentic?
Yeah, but this authenticity is referring to the patient's authenticity.
Okay.
The patient is able to live his authentic life.
Uh-huh.
So because he is able to live his authentic life, it contributes to healing. Now, the second question that you raised is also correct, that the patient will see that the person who is encouraging me to be authentic, is he really authentic? So you are right. The therapist must have the credibility to speak these big words, because these are big words.
Yes, absolutely.
Authenticity, integration, shadow work, these are big words. These are easier said than done. So the patient will very easily figure out whether the therapist is speaking out of his depth and sincerity, or is he just speaking because he's been trained to speak these things. And when somebody speaks as one is trained to speak, it does not have much effect. Like every therapist is told to be unconditional and amoral in acceptance of the patient. But the patients figure out very quickly in few sessions that you are not really authentically accepting. And then automatic repression starts.
The thumbs up icon, it came automatically, so it was authentic even by the computer, I suppose. I did not give it. It understood what we were speaking, and
Even artificial intelligence agrees to us.
yes, sir.
So you are very right, and this is not only true in Jungian therapy, but even more true in existential psychotherapy.
Yes.
When you ask the patient to be authentic, do you have the courage to be authentic? So the paradox here is, in DSM terms, we have a name called adjustment disorder. And authenticity many times may mean not to adjust to society. But the difference is, because it is done at the depth of yourself, it does not lead to disorders. It may lead to a conflict with society, but not to a disorder. Like a normal adjustment disorder may easily lead to depression or anxiety. But this will not lead to depression or anxiety. It will lead definitely to conflict in many cases. Because here we are saying not to adjust. Because many times to be oneself, one has to give up adjusting to society. So in a way, it may look like we are encouraging adjustment disorder, but does not happen that way. So it's like Krishnamurti used to say, ki being well adjusted to a sick society is a sign of sickness, not of health. I am reminded of a very good saying by Kierkegaard. Kierkegaard used to say, nothing can be more humiliating than to be respected by them. So it is that kind of a situation that when you are living in a sick society, adjustment itself has sickness built into it. And then when one starts walking the path of authenticity, then real life concerns come up. How far can you live authenticity? That is step 2. Step 1 is how far are you ready to be authentic? So first is our own readiness and preparation, and second is the constraints of the environment. That the constraints of the environment may be such that even if you wish to be beyond a point you cannot be, your professional or personal survival may be threatened. And there you compromise, but you compromise very consciously and with remorse. That I wish this was not to be, but I have to accept it. Now that becomes a profound reality acceptance. So Heidegger says accepting inauthenticity for survival is a part of a transparent authenticity.
I have to understand. I'm not sure I understood it completely.
When we start walking the path of authenticity, the price becomes so high that it may not be possible for everyone to risk it. And at that point, we stop being authentic and we accept that in 10-20% of our life, we have to be inauthentic. But that inauthenticity is consciously accepted because there was no other choice. So
it is transparent.
So it is lack of, so inauthenticity is also a part of authenticity when it is done with profoundness and transparency.
Where there is consensual validation, to use Erickson's terms, I suppose.
Correct. And this is also what Winnicott says. We will cover it next time when we do Winnicott. He talks about a negative capability.
Okay.
Like the positive capability of a therapist is to make an intervention, say something, do something. But the negative capability is to hold the patient. That whatever projective identification is coming into me, I don't act it out, I don't respond, I am able to contain it. And this negative capability is also very important for patients. That the therapist is able to contain difficult to contain emotions. And they test you out unconsciously. So this negative capability is very important. Similarly here, at some point, initially on the path of authenticity, the positive capability is important. And at some point, when the stakes become too high, then the negative capability also becomes important. Knowing oneself, that also heals. Understanding of the symbols in one's psychic world, that also heals. It's a very important component of healing. The meaning of symbols in our psychic world. Whether they come up in dreams, whether they come up in day fantasies, whether they come up in scribbling, whether they come up in our projective tests. So the meaning of symbols in our inner world, when we discuss those meanings and the symbols render themselves to meaning, that process itself is health-giving process. The process of the symbols speaking themselves. The symbolic is converted into the linguistic. Self-finding feels that what is my blueprint? What am I supposed to be? Just another way of saying what is the purpose of my life? Just recasting the same question in different words. Self-finding, allowing the self to express itself, allowing the blueprint make itself conscious. Strengthening of the ego self-axis by balance and integration, by analysis and catharsis. The ego self-axis is strengthened not because we just will it, but because we have done analysis of the inner and outer world, because we have done catharsis, because we have done balancing, we have done integration. All of that strengthens the ego self-axis. And the relationship with the therapist, the most important element. Do you feel safe? And this is a 10-hour question. Do you feel safe? Because this has levels upon levels upon levels. At what level do you feel safe? And the deeper you feel the safety, the deeper will be the free association. And the more honest will be the free association. And more material from the depth will come out. So safety is a very important and complicated word. In fact, most people face a crisis of safety. That at a fundamentally deep level, they don't feel safe. The safety may be intrapsychic, that something difficult will come up from inside, or the safety may relate to the external world, that something horrible will happen in the external world, which gives rise to catastrophic thinking both about the inner world and outer world. That the crux of catastrophic thinking is that at some level you don't feel safe. You don't believe the world is a safe place or my mind is a safe place. And therefore the safety is levels upon levels upon levels. And the more safe a person feels, deeper and more original the free association becomes. And deeper we are able to access the mind. And deeper we are able to heal it. In fact, there is a very good book by John Frederickson on this. The title is Co-Creating Safety. How does the therapist work with the patient to create safety? Because at a very deep level, even with the therapist, there is a sense of not feeling safe at some level. Of course, you feel safe with the therapist 10 times more than with any other person. But that safety also has to deepen and become more. And at some level, you will see on a 10-point scale, if you feel safe with others at 3, then maybe with the therapist you are at 7, but still you are not at 8 or 9. So safety is very important in the relationship. In fact, even when you are alone, you don't really feel safe. There are apprehensions about difficult material coming from inside. There are apprehensions about our own limitations, about our mortality and death, about possibility of pain arising from inside. So how safe can you feel with yourself, with the therapist, and out there in the world while you work or you relate? So that is very important. So the relationship with the therapist is very important. And the core there, I would say, the first is safety. The competence comes later. What is the goal of Jungian therapy? Symptom removal, self-knowledge, authenticity, individuation, and self-realization. So you will see out of 5, 1 is clinical and 4 are non-clinical. So this is really not a clinical psychology focused school. It is more like a seeker's school. Any questions?
Amazing. Thank you.
So we started off with Freud, then we went to Klein, then we went to Bion, Jung, and next we will take up is Donald Winnicott next time. About Donald Winnicott, there is only two popular things about him. His concepts, one is good enough mothering, and second is the transitional object. But actually there is a list of concepts which are very interesting that he talks about 10 or 12 of them. So we'll slowly take it up, Donald Winnicott. We'll first go into an introduction, how he made a transition from being a pediatrician to being a psychoanalyst. And there's a very famous book, From Pediatrics to Psychoanalysis. How he got his interest first from the body of the child to the brain of the child to the mind of the child and finally to psychoanalysis. So,
Sir, which was the earlier book that you mentioned just now?
it is
Before
called, it's called Co-Creating Safety.
By?
John Frederickson.
Yes, sir. I'm sorry, I did not take it down immediately. Yeah.
John, he has written, I think, 3 important books, I believe. One is Co-Creating Change. That is about ISTDP, Co-Creating Change. Second is Co-Creating Safety. And third, I am not sure he has written or somebody else has written, but it's a very good book. It is called Working Through Resistance. That the person who comes to us paying money, spending his time, energy, of course is motivated for healing. But even in such a motivated person, there are such heavy resistances that so much of time in therapy goes in working through resistances. In fact, a large chunk of therapy goes in working through resistances. So it's a good book, Working Through Resistances.
Dr.
I did realize, sorry.
No. I just wanted to check these lectures on Winnicott. How many weeks will we have?
Winnicott, I think we should be able to complete it in 3 sessions, I believe. 3,
Okay.
maximum 4. 3 should be.
And after that, are there any other analysts that you'll be looking at?
Yes. After that, a very important one, hence Kohut.
Oh, okay, great. Okay.
Because Kohut is something that I believe he has articulated very good concepts, but he has not been used or honored adequately. Many people don't even know the name of Heinz Kohut. But some of his concepts are so good. There are 2 psychoanalytic thinkers, I think, who have not got the due recognition. One is Heinz Kohut and second is Margaret Mahler. So what we will do...
Symbiotic psychosis.
Yes. So what we will do is, we will do Winnicott, then we will do Kohut, then we will do Davanloo, and then we will do Margaret Mahler. And with that, probably we will end our series.
Thank you.
But now it will be quick ones because Freud and Jung take a long time. Others are, we can quickly have an introduction and complete. there are no questions, we stop for the day.
Yes, sir.
Thank you so much, Dr. Vaidya.
Thank you so much.
Thank you. Bye.
Thank you, sir.